All right, so today we're going to dive into something pretty amazing, a new approach to a really tough disease that asks a pretty hopeful question. What if we could use our own stem cells not just to fight back against damage, but to actually rebuild what's been lost?
I mean, just think about that for a second. The very system that lets you move, feel, and stay balanced, what if it suddenly came under attack from your own immune system? For some people, this isn't just a what if, it's their everyday reality. So let's get into it. The challenge we're talking about is a rare autoimmune disorder called chronic inflammatory demyelinating polyneuropathy. You can just call it CIDP. It's a progressive and, honestly, often a devastating condition.
So what exactly is going on here? Well, think of your nerves like electrical wires. They've got this protective coating, this insulation, called the myelin sheath. In CIDP, the body's immune system gets confused and thinks that myelin is a threat, so it attacks, stripping away that crucial insulation and scrambling all the nerve signals. And the fallout from this? Well, it can just completely turn someone's life upside down. We're talking about progressive weakness, losing your reflexes, a constant state of numbness and tingling, and a loss of balance that can make just walking across a room a huge challenge. And in the worst cases, it can lead to severe disability.
Okay, so how do doctors fight this right now? They have a kind of treatment ladder. They start with things like corticosteroids to try and calm the immune system down. If that doesn't cut it, they move up to even stronger drugs. And in the most stubborn cases, they might use high-dose chemo to basically reset the whole immune system. But notice the strategy here. It's all defensive. It's all about stopping the attack.
And that brings us to the big limitation, the wall that patients and doctors hit. As the source material puts it, these treatments, quote, do little to restore neurophysiological function to the individual. In other words, they might stop the disease from getting worse, but they don't fix the damage that's already been done. They don't rebuild the nerves.
But this is where the story starts to change. What if there was another way? A way to go on the offense? Well, let's introduce a potential new game changer. Adult telomerase-positive stem cells, or aTPSCs for short. So what are these things? Well, they're these incredible stem cells that are already inside our own bodies. And what makes them so unbelievably exciting is their potential to do what current treatments can't. Not just stop the disease, but to actually go in and repair and regenerate the damaged nerve tissues. Now, to really get why these cells are so versatile, we've got to talk about size. Not all stem cells are created equal. You have the totipotent stem cells, or TSCs. Think of these as the tiniest of the bunch, like a marble. Then you've got pluripotent stem cells, or PSCs. They're bigger, maybe like a baseball. And finally, mesodermal stem cells, meso-SCs, are bigger still, kind of like a volleyball. And as you're about to see, the size difference is actually a huge deal for how they're used. But their real power, it's their incredible potential to transform. Now, I know this chart looks a little complex, but the big idea here is actually super simple and powerful. These stem cells can change into all sorts of specialized cells, the building blocks for muscle, organs, you name it. And most importantly for our story today, they can become neurons and Schwann cells, the exact parts needed to rebuild a damaged nervous system. Okay, so the theory is solid. The potential is huge. But does it actually work in people? Well, let's look at the groundbreaking clinical trial that put these aTPSCs to the ultimate test.
Now get this, the study was tiny, just 3 patients with CIDP. But here's the kicker, all 3 of them were considered refractory. That means they had already tried all the established treatments and nothing worked. They were basically out of options.
So how'd they do it? The protocol was actually pretty brilliant. First, they harvest the patient's own stem cells right from their blood. Then, they separate them out into those different types we just talked about, the TSCs, PSCs, and meso-SCs. The bigger cells were given through an IV, but the smallest cells, those little TSCs, were delivered in a really clever way. And this right here, this is the truly innovative part of the whole thing. Remember how we said those TSCs were tiny, like marbles? Well, that's their superpower. Their small size lets them be delivered intranasally, like a nasal spray. And from there, they can sneak past the body's super secure defense system, the blood-brain barrier, giving them direct access to the central nervous system where they can get to work repairing things. It's an incredible workaround.
So, the big question, did it work? The results are pretty staggering. In this small group, 2 out of the 3 patients, that's 66%, saw their neurophysiological functions restored. Now, you're probably seeing that one patient had no change. It's super important to note that the study notes that this person did not follow the required protocol.
So let's be clear, what does function restored actually mean for a person? This isn't just some numbers on a chart. It means getting movement and feeling back. It means more strength, an end to numbness, better balance, and being able to walk normally again. And get this, all of it was achieved with no reported adverse events. That's huge. So what's the big takeaway here? Where do we go from this? This tiny study hints at something so much bigger, a brand new way of thinking about how we treat not just CIDP, but maybe a whole lot of other conditions too.
And what's so exciting is that this doesn't seem to be a one-off just for CIDP. The same research group has seen really high success rates in other studies for all sorts of tough conditions. We're talking Parkinson's, COPD, even traumatic blindness. You can start to see a real pattern of promise emerging here.
And really, this slide sums it all up. We're talking about a fundamental shift in medicine, a complete change in the goalposts. For so long, the old way of thinking was just to manage a disease, to slow it down. This new paradigm is about something else entirely, actually restoring function. It's about actively repairing damage and rebuilding the body. It's a shift from playing defense to going on offense.
It's just a massive idea, right? And while, yeah, this is still early research and there's a lot more to do, it forces us to ask a really profound question. What if the most powerful medicine in the world isn't something we create in a lab, but something that's been inside of us all along?